Hello, everyone. I would like to share to you some actual concepts of facial aging. Actual because when I was graded in 1995, we exit to the world of the aesthetic field with a toolbox, and we used to know what we have to do in the upper third of the face and the mid third of the face, and also in the lower third of the face. But what about injectables? We didn't know so much. We just knew how to perform a lip injection or nasolabial fold or marionette fold. So we used to use the topographical division of the face, divided in thirds: the upper third of the face, the mid third, the lower third, and that's it. Even in the profile, we used to have some tools in order to divide the types of the profiles. The results that we used to have in those ages, this is the lady with the blepharoplasty, facelift, nasolabial fold injectables, lips injectables, and marionette fold injectables were not so good at all. So this concept, moving from this elderly lady to the other one, really not was very pleasant. So our current approach is to see that the aging of the face suffered two stages. Up to 40s, nothing happened, but after 40s, we suffered two stages. The first one is the deflating because the loss of the fat pads, and the second one is the sagging. So I would like to share to you other concept, which is the volumetrical division. Why? Because we have three sides of the face. If we are watching a face from above, we can see a front view, a profile view, and this side, which is the mid-profile view, is the third side, which I call the young side. Why? Because it's the side where we are losing when we lost the volume of the soft tissue, which means the fat pads, and also the resorption of the bone. This is the lady seen from above, in which we can see the front part of the face, the lateral part, and the loss of the third part of the face, which become to be a part of the lateral part of the face. The main part of the most important part of the third side of the face is the cheekbone. This is the typical lady that asked in my office to perform an injection of the nasolabial fold, which is the consequence. This is the symptom, but the disease is up in the loss of the mid part of the face. Look at this profile. If the patient doesn't understand so much, I usually use the Vectra system, in which volumetrically I can show her all the loss of the volume in this part above the nasolabial fold, for instance. So up to now, we make another kind of division, but this is a functional division, which was introduced by Dr. Brian Mendelsohn from Australia, who make a functional division. And he divided the face in two parts: the moving face and the still face. The moving face is the front part of the face, which is destined to the communication between one person and the other. This is the moving face, and the other part of the face is the lateral face, which he calls it the still face, because it is still. This is fixed. It doesn't sag, produces sagging. And this is destined to the mastication, not to the communication. The moving part of the face, which is destined to the communication, is plenty of holes. And when we have holes, we need shutters. If there is shutters, there are movement, and when there's movement, there is aging. The division between the lateral and the front part of the face is all this line full of ligaments. We have the temporal fusion, the orbital returning ligaments, the zygomatic ligament, and these are minor ligaments up to the mandibular returning ligament. And here is another one. This is the false ligament, but it's very important, which is the premasseter ligament. Between the premasseter ligament and the mandibular returning ligament, we have the jaw, which is gliding into this space. Put this concept into a normal face, we have all these pygots. Look, the temporal fusion, the zygomatic ligament, the premasseter ligament, and the mandibular returning ligament. So for me, it's very important to, I will leave this, for me it's very important to make this concept of aging, because it's very important to divide the face into, this is the first part that I would like to share you, because this is very important. The ligaments, the line ligament of ligaments, the temporal fusion, the zygomatic ligament, and the mandibular retaining ligament, and the premasseter ligament. These muscles are the temporalis and the masseter, and the rest of the face is destined to the communication, which is the sagging, the deflating, and the sagging also.